definitions literally means when don't I massage somebody? When do you not massage somebody? And anytime you take, I don't know, I feel like anytime you see some massage thing, there's always something at the bottom that says contraindicated for people who are on fire, right? So no matter what, it's contraindicated for people who are pregnant, contraindicated for whatever. It depends on what the technique is. But let's say it's a really, it's a real hot bath treatment or something. It might say contraindicated for women that are pregnant because you don't want to heat up their core temperature too much. Things like that. So you'll often see some type of contraindicated statement on lots of massage. This chapter drives me nuts because there's actually just a few things I want to tell you about contraindications, and I will, and then there's a lot of definitions in here, and some are important to know about. We are entering a medical field, and so some things are important, like acute and chronic and things like that. It's not much fun to lecture on, and so bear with me. Just bear with me, okay? We're just getting to the top of the roller coaster, I promise. You know, a little click, 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 click here as you go right up to the top? Good. All right. Any questions before we get started? Any questions occur to you while you were laying on the massage table in lab today where you're like, I've got to ask Tapscott that. What is the meaning of life? Yes, Miss McDowell, please.
It's normal to be like sore from massaging to start with. Is that okay? Because my back is killing me.
Okay. So wait, now is it normal? By the way, the answer is yes, no matter what the question meant. But I just want to make sure I understand the question. Yes, it's normal. But are you meaning, is it normal to be sore from being massaged or sore from massaging?
From massaging, like
the physical act of it.
The muscles by my spine are like super sore in the middle.
Yeah, that's 100% normal. Bodies are highly specialized, and they highly specialize themselves. And so, I'll never forget, I used to be a personal trainer. You wouldn't know it by looking at me, but I used to be a long time ago. And I was in really, really, really good shape. And I went snowboarding for the first time. And the next day, my abs and things like that, you have to get up with your abs and the snowboard and things like that. I was so sore, and I'm like, I don't understand it. Like, I can go to the gym and do like 400 stomach crunches and climb up a rope and slay a dragon, and I get on this little snowboard and I'm dying, and it's because your body really has to build up to that specific thing, right? And so you have not built up to this specific activity, but your body will, yes. And so I'm glad you're sore. It probably means you're actually working. Whereas if you're not sore, the rest of you aren't sore out there, get sore. This is your time to build up stamina and stuff like that. We want you sore. You like get in there and you should be working it. And I do recommend you stretch your back, and I do recommend you play with new positions, things like that. But yes, perfectly normal. Also, by the way, for you guys with your clients and yourselves, start thinking about distinguishing between two different types of soreness. By the way, there's probably 400 types of soreness, but two ones I want you to think about. Muscular soreness, which is that kind of deep ache, kind of like wiggling a loose tooth kind of feeling, kind of like, and joint soreness. Joint soreness is something to be worried about. Joint soreness is when you've actually kind of injured the joint. It's kind of an arthritic feeling, things like that. But your back being like, oh, back stiff, it's been working really hard, that's probably fine. That's all muscular. You'll get over it. You're young. Quit your belly aching. No, anyway, that's normal. Yeah. It's also normal to be sore from the massage itself, from receiving them, just because you're not used to being poked and rubbed and things like that. And you will get rubbed in areas like many of you probably never had somebody rub your gluteus maximus before. And when they get in there with your elbow, you're like, oh, that feels really good. But the next day you're like, wow, my rump. Because it's just not used to it. That's really normal too. Cool. Any other questions? I appreciate your vulnerability, by the way. It's very important we kind of share experiences. Ms. Suriel, you have your hand up? Or is that left over? It's left over. She's like, no. But your hand was up even when you were saying no? Okay, anyway. All right, any other questions? No? Okay. Yeah, all that's normal. It's also normal, by the way, to have massage like trigger little kinds of emotional issues as you go along. You have strangers touching you, right? And they're touching your bottom or your stomach or your leg, or that's kind of normal to have that be like, this is awkward. I feel awkward about this. That's very normal. That's very normal. So try to stick with it if you can. Speak up if something really bothers you. It is your body. Don't forget that it's your body. You can always say no, stop, all that kind of stuff. But when you know it's just you up here, try to let it go, because we want you to get kind of used to all this stuff. Yeah, cool. You'll also have stuff come up with like feet and all that kind of stuff. We have all sorts of weird stuff in our society about things like that. All right, cool. Let's take a look at standard precautions, contraindications. Contraindications, again, are when not to do massage. Con against indication. Massage is not indicated in this area. You have two considerations as a massage therapist. And one is you always want to keep your client happy, but you also always want to keep your client safe. It's great when those two things go together, but sometimes they don't. And clients are usually not happy when you tell them they can't get their massage. But there are times when it's not safe to do a massage on them. They're fairly rare, by the way, believe it or not. Your book makes it sound like this happens all the time, and people come in gushing blood out of the side of their neck and want to get a massage, but that's not really what happens. It's very rare that I've ever had to not do a massage, but we're going to talk about that. So, let's see. The thing I love about massage, the thing I love about massage therapy is that it's probably the safest, least intrusive pain treatment known to man. When it comes to relieving just general discomfort and self-care kind of stuff, massage is very safe. And at the bare minimum, if you really stink at it, as long as you're moving slow, because remember, fast is karate, slow is massaging. As long as you're moving slow, the absolute worst thing that could happen is your client could leave the exact same way they came in. $50 later, $100 later. To me, that's pretty good. That's not true with surgery, right? So I'm not putting down surgeons, but surgeons create miracles, but sometimes people leave worse sometimes. Quite worse sometimes. Even chiropractics, people leave worse sometimes. Massage, they essentially never leave worse. In my entire career, you gotta remember this, 15,000 massages, I bruised a couple of people. They didn't even care. I mean, that's it. Bruises. Bruises go away. You will bruise somebody someday because some people bruise easily. But that's pretty good. Not once has somebody actually been worse. That's kind of nice. Even working at the Princess and overseeing millions of massages, we burned some people with some hot stones. One therapist hurt somebody's neck because they weren't listening to him, and that's about it. So essentially, if you're being careful with your client and you're just using some common sense, everybody leaves the same or better. And I love that profession. I've had many people say, well, how do you know a massage is going to help? And I go, I don't. But what do you got to lose? You still got a massage. Like it's a no-brainer. And we will talk about conditions later like carpal tunnel, which is a risk condition if they've diagnosed it properly. Massage can often make it better, not always. But what do you have to lose to go get like 3 treatments on your wrist and massage and see if it starts getting better before they cut into it? Which is kind of nasty. So, anyway, that's what I love about it. And really some of your big stuff is to keep your hands clean, keep your sheets clean, look for big warning signs of somebody not being healthy enough to get a massage. We'll talk about that. And avoiding what they call endangerment sites. So endangerment sites are not places you shouldn't rub. They're places you shouldn't rub deeply. You can rub the front of a throat. I mean, I wouldn't advise this. It's not my great opening move for a client, but there's nothing dangerous about this. But I wouldn't put an elbow here. That's an endangerment site. Most of your endangerment sites, by the way, are at folds of your body. So This is called my axillary region. We're going to learn that probably tomorrow. It's your armpit. But massaging deep inside your armpit is not a great idea. You can push in here, but if you guys poke inside your armpit right now, you'll actually feel it. It's very tender in there. There's no muscle in there, and there's veins and arteries and nerves poking out right there. It's considered an endangerment site. So we don't drive an elbow in there. Does that mean I can't get the sides of my armpit and grab them and beat them? Yes, you can. That's not an endangerment site. We're talking about right in there. And some people are like, I can't even touch that. You can touch it. It just, and the client's going to look at you like, that does not feel good. And you stop. That's true. The other endangerment site is right in your groin, and you're never going to be working that tight on a client. You're never going to be working right in their groin. And so those are endangerment sites. And this gives you a really good idea. Here, hold on. Let's see. If you look at this guy, this just gives you a good idea. The arms are the same. But you see these veins and arteries right here. They're really close to the surface right here. And so we don't go driving in right here. But if I put my elbow in on any of you right here, you'd probably be really mad at me already, because this is a really sensitive area. I'm not even talking about being kind of violating, it's just sensitive. So we're careful about stuff like that. And we're careful right up in here because of the same thing, because of the veins and arteries coming out here. They're not going to burst. There's not going to be blood flying out. It's just a great place to cause some damage if you go in really deep. The other place, another bend, back of the knees. Can I work on the outside some? Yes. But right in the knee pit, just like an armpit, but it's a knee pit, there's not a lot of muscle covering over the arteries and veins and nerves. That's it. So that's the kind of obvious endangerment sites. Oh, sorry guys, I gotta get the guy back on the stick. Okay, all right. Mr. Barr is signaling to me. Do you want to bring back the skeleton, or do you want to take that thing? All right. He always signals to me through the window. I have no idea what he's saying. Anyway, okay. So, hands, no, good. All right, endangerment sites, good. So avoid knee pits, armpits, and groins, and throats. And again, don't freak out. You could rub them all day long. Just don't go in deep on them. And if you ever wonder if some place is an endangerment site, poke it on yourself and see how it feels. If it feels great, go ahead and do it on somebody else. If not, but you're coming in, buddy? Bring in my skeleton? Whispering doesn't help. I gotta put on my mask. I'm teaching class right now. They've been saying nice things about you.
Oh,
yeah.
Thank you.
Yeah. Here. Want to wave to everybody? Hey, everybody. They can't see you. Come on over here. Say hi. Hi, everybody. Who can't see you? There you are. You're right there.
Hey.
Hi. All right.
Oh,
Dude, it's okay. It's a big class, huh?
yeah.
Yeah.
All right, put it all back in one piece.
All right. Thank you, sir.
Thank you.
Good. Woo. Mr. Barr is amazing. He teaches 3 labs a day. That's 9 hours of lab a day. It makes him a little crazy, though. You probably noticed that. But anyway, all right, don't tell him, because he just... Oh. All right. You know how crazy people are. Okay. So endangerment sites. Let's skip on through this. Okay. So these are just some terms that are good to know. Some are good to know because they're going to be on your test, your online test, to be very honest with you. But you know, disease is something you should know. I want you to think about the term disease, by the way, because many of your clients will come to you with disease, and it is lack of ease. That's what the word means. Dis, without, or lack of, ease. Dis-ease. And I think some kind of people forget that. Quite often, disease is just a lack of normal functioning in the body. Something is stopping what's supposed to be working. In massage, quite often, we're trying to increase blood flow because that's supposed to be working. Any word, we deal with a lot of Latin words here, and any word that ends in ology means study of. Ology actually means study of. Pathology is the study of disease. We will actually study a lot of syndromes in this class. Carpal tunnel syndrome is a great example. I just thought of it because I just mentioned it before. But carpal tunnel syndrome is a wrist problem, but it's shown with all these symptoms that go together. Weakness in the wrist, numbness in certain fingers, things like that. And so they call it a syndrome. Diagnosis, which is actually identifying a particular disease. And guess what? Are you guys allowed to diagnose? You are not. Your massage license does not allow you to diagnose. You do not want to diagnose. Diagnosing sets you up to get sued. You're not qualified to diagnose. I'm not qualified to diagnose. We're guessing. And so I'll often have clients, by the way, I guarantee you, you're going to have it happen next week. Some of you. Somebody's going to say, hey, I know you're not a doctor, but you're going to massage school. What's this thing over here? And you're going to be like, I've had 7 days of class and you're asking me about a growth on your neck and we're not even going to study that. Like, I have it to this day. I mean, this day, once every couple of weeks, somebody comes to me and says, hey, I know you're not a doctor, but, you know, what's this thing? And I'm like, I don't know what this thing is. Like, how would I know? Your doctor doesn't know. They got to go biopsy it or whatever. Anyway, don't diagnose. Sometimes when clients ask me, like, why are you doing a particular technique? And I say, because I'm thinking there's a chance you could have a herniated disc here. I'm thinking there's a chance. And they'll be like, is that what I have? And I say, look, I am not qualified to tell you that. I'm sorry, I'm laughing because I just gave the other class the biggest test they've ever had since they've been with me. And they're so mad that they're walking by the window over there, like outside my classroom, and they're literally going like this to me. So it's like 240 questions. So anyway, you guys get to look forward to that in about 5 months. It's a really good day, though. It's a really important test. Anyway, and it's online. They had time to do it. Yeah. Anyway, apparently I could be dead by then, so don't worry. Okay. Anyway, so don't diagnose, but it's okay to tell them I have a hunch that this thing is this thing. That's why I'm doing this. I have a hunch that your nerve is impinged here. I have a hunch but I'm not qualified to do it, but that's what I'm operating on. And I tell people that. People tend to believe you even more when you say, look, I don't know for sure, but I think it could be this, this, or this, and so that's what I'm working on. But you got to go talk to your doctor. Cool? And a prognosis is a prediction about the outcome. Can't really make that claim either. But just to be very clear, massage therapists are not legally allowed to diagnose. No, no, no. We do look for signs and symptoms. So, yes, who is, oh, Mr. Blygen, yes, sir. Is that you who raised your hand, Mr. Blygen? Yes. I see your mic's on, but I don't hear you. Hello? Your hand up is a sign that you want to talk, but the lack of sound is a symptom that you might not have good internet. And it shows you're not muted too, but I can't hear you. I see your smiling face. Yeah? You're going to work on it. He's like, okay, I got this. All right. Okay. You're muted now. Have you just given up? No? You're working on it. Okay. Just literally interrupt me when your mic works. Just go ahead, okay, sir? All right, so anyway, we do look for signs and symptoms. We are going to, later in this class, the fun part and the really interesting part and the part that will set you aside from many other massage therapists in this highly competitive field, by the way, and I'll explain that in a second, is your ability to guess at stuff and look for signs and symptoms to support your guessing and then work on those problems. So if you come in with neck pain, I'm trying to figure out, is it actually your neck or is it your lower back that's causing the neck problems? Or is it your hips that are causing the neck problems? Or your feet that are causing the neck problems? Because all those things can be true. So I'm looking for stuff like that to try to figure out what's going on. Even if you get better, it doesn't mean I was right. I could have guessed the wrong thing but worked on the right thing, right? Don't get too cocky. When I first got out of school, I was like, oh, you have this thing for sure. And many years later, I found out I was stupid. So, but you can make very educated guesses, and it makes you right more often than not. And you look for signs and symptoms, like if I really think that this muscle is shortened, then the arm should not go out here. Oh yeah, it's not going out here. I could be right about that problem. That kind of thing. By the way, when I say that it's a very highly competitive field, I don't mean it's highly competitive that you can't get a job. I mean, it's very highly competitive, like kind of pay-wise. And there's a big range in how massage therapists are paid. And ones that can kind of figure out problems tend to get paid a whole lot more, tend to make a lot more money. And that's always nice. Yeah. Okay, really quickly, acute disease is not an adorable disease. It's usually a really quick thing that happens very fast and is over very fast as far as diseases go. When you break a bone, that's actually an acute accident. You have broken the bone, which is really severe, but it's fast, and the bone will heal actually fairly quickly. Yeah. I have a question for you guys. Do we know what tendons are and ligaments are? Anybody kind of, not maybe a little bit? Okay. So tendons attach muscle to bone. They're connective tissue. Anybody here eat chicken? Any barbarians here kill poor little chickens and eat them? All right. Just vegan joke. Anyway, have you ever seen the white part right at the end of like a chicken breast or something that looks like a white? It's a very hard, rubbery little rope. That's a tendon. That's meant to, when you're eating chicken breast, by the way, you are eating a chicken's pectoralis major. Just to let you know. And that little white band was attaching it into its cute little chicken arm. Anyway, that's a tendon. Ligaments are exactly like that white band, but they just attach two bones together to help kind of hold bones together and stuff like that. Would you rather break a bone or tear a ligament or a tendon?
Break a bone?
Break a bone, yes. Why? You're right.
Bones can be set, they can be cast kind of and set. You can put hardware into them. There's a lot of things you can do with the bone structurally, whereas with a tendon or a ligament, I mean, there's really nothing you can do except rest and try to exercise it properly.
Yeah. I mean, they can screw ligaments back on too, but yeah, bones heal faster. Bones heal faster than tendons and ligaments because bones are actually highly porous. They allow a lot of blood into them, and blood is life. Ligaments and tendons actually don't allow that much blood into them. They need some, or else otherwise they wouldn't be alive and they wouldn't keep healing. But because they don't allow a lot of blood into them, they repair very slowly. Yeah. What you really want to do is tear a muscle. Those things heal like that. You probably tore muscles in class and not even known it. Yeah. Miss McDowell's probably got some tiny torn muscles in her back right now. It's probably part of the reason it's sore, but it's going to heal like that. Yeah. But tendons and ligaments really take a long time. In fact, tendons and ligaments, when they get harmed, often do have chronic type symptoms where they don't seem to heal very well. And that's chronic disease. Disease that doesn't seem to heal in a normal time frame and seems to keep going. So lots of people have chronic back problems, for example. They hurt their back 10 years ago and it still hurts. That's a chronic back problem. And I bring this up because you will have lots and lots of clients that have chronic headaches, chronic back problems, chronic neck problems, where the doctors can't quite find the problem or it's not worth fixing. So they can't quite find the problem, or it's like a herniated disc, it's pushing on a nerve, but it doesn't really pay to kind of go in there and shave it down and take a risk of making other injuries and other scar tissue. So what do? They have two choices, which is lots of drug medication or massage. And massage is actually usually prescribed by a lot of doctors for this type of chronic stuff. It's one of the best pain mitigators is massage therapy. Cool. This is kind of important. This concept is of a local disease and a systemic disease. And I care about it too because there's such a thing as local contraindications and systemic or general or absolute contraindications. And let me explain. What does local mean? Anybody?
One spot.
One spot. It's in one spot, right? It's in your neighborhood. So I know this isn't a disease, But if I've got a burn here, it's a local problem, right? You can still rub my other arm. I've got a burn over here. But you might not want to rub the burn, right? So local diseases only affect one area. In general, if they're non-contagious, you just avoid the area when it's a local disease, right? Somebody says, I have a rash on just this arm. That's a local disease. I just avoid that arm. There's no reason I can't get a massage. Systemic diseases we tend to worry about a little bit more because your whole body is being affected, and therefore there's not a lot of places I can rub that aren't going to affect a systemic disease. And let me give you an example of a real simple one that's usually a contraindication for massage, and it's if somebody's running a fever from flu. So the flu is a little bit contagious, but that's not actually what I worry about so much. By the way, most people, not all people, but most people when they're showing symptoms for a lot of diseases, not all, unfortunately not COVID, they're not contagious anymore. The symptoms they're showing are because they're fighting the disease and they're not so contagious. They were contagious when they were feeling great and you guys were hanging out for a whole week before. That's when they were contagious. But anyway, when somebody's running a fever, it says their entire body is trying to fight a battle. And that's probably not a good time to do deep tissue on them. So the general rule of thumb is if they're showing these problems of really fighting something systemically, something big, that's a time to not do massage on them. Can you give somebody who's got a cold a massage, who's not running a fever? They're just running a nose. Would you? Anybody? Take a guess. Whatever you think. Mr. Black?
Yes.
Yes. Yeah. Thank you, Miss Walker. T. Yeah, you would. You sure can. I mean, sure call. You don't have to. But you're going to be turning around a lot of clients. Lots of people come in with a little sniffle. And you don't know if it's allergies or cold or whatever. It's completely safe. Most massage therapy textbooks will say it's fine. They're not running a fever. It is a systemic problem, but it's a mild systemic problem. And so we say, yep, that's fine. In fact, a lot of people, including me actually, I think, now I'm thinking about it, think that it kind of gets the cold out of you quicker. Kind of flushes it out of your tissue faster. So anyway, that's very common. That gives you kind of an idea. So we do have things that are called local contraindications, which means a local contraindication is you avoid that area. A general or systemic, or sometimes called absolute, and we'll go over this again, don't worry. Contraindication means we don't do the massage at all. So local contraindication is you slammed your thumb in the car door. You don't rub that thumb, but can I still get a massage? Yeah. You could have really slammed that thumb and you can probably still get a massage, right? That's a local contraindication. My whole body was in a car accident. That might be a systemic, general, absolute contraindication. Yes, Miss Walker T.
Mr. Tapscott, so you were talking about like if someone has a fever, their body's already fighting something, so maybe not a good idea to massage it.
Mm-hmm.
Is that kind of just a rule of thumb if you have a fever at all, no massage, or do you like separate it between how high the fever is?
I'm really glad you asked this question. I'm always really torn how to answer it. Let me give you all this disclaimer. There is the textbook answer that's in your book that says, I think it says if somebody has a fever, you don't massage them. Like that's the textbook answer. If somebody has a fever, you don't massage them. There's the real world where somebody comes in with a 99.2 instead of 98.6, and most massage therapists are like, I need to eat this week, and this is my regular client, and they look like they're feeling fine, and they work on them, right? And
Right.
I gotta warn you about your teacher, this one, not Mr. Ibarra, not Miss Bauer, not Miss Waite. This Mr. Tapscott's over here going, like, I bend a lot of rules in massage. I really do. So I don't even care about your temperature so much. I just care like how healthy are you looking when you walk in. If you're coming in and you look like you're dying, then no, I'm not giving you a massage. But if you come in and you're like, it's 101, but I actually feel pretty good, and I really, really want a massage, and you're my regular client, like, I can't believe I'm putting this on tape right now. I would massage you. I am not telling you guys you should do that. I just, I was taught very old school. We took a lot less precautions back there, but I've never once had problems with that. And I have had people with fevers that I've turned away, where I was like, no, you're sick. So it's just a very gray area. But the politically correct answer is do not massage people with fevers, right? But in the real world, you're going to have some client come in and they're going to be a little sniffly and they're going to be running a little low fever, and you're going to think, gosh, I see Waldo twice a week. He seems fine to me. I'm probably going to do a massage. That kind of thing happens. But high fevers, no, do not. So I'm sorry, that wasn't really an answer. Just told you that there's 3 different kind of schools of thought out there. Yeah. Let's see. We're going to skip by some of that. How might risk factors or your factors that increase your chance of getting disease? Is there, by the way, throughout this entire course, I'll be mentioning benefits of massage. And I hope that you'll tack them inside your head, because someday, many people, not one person, someday many people are going to say to you at separate times, they're going to say, well, why should I get a massage from you? Why should I spend $100 on a massage? And that is a hard argument to make. I mean, think of all the things you can buy with $100, right? These days, what, a pack of pencils, an eraser, I don't know. But the point is, you can buy a lot of things with $100, and so why should I get a massage? So one of the benefits is that massage can reduce your chance of getting ill. How can it do that? And Miss Walker, Miss Walker T, do you still have your hand raised, or is that, okay. She's like, no, forget it.
It's moving your lymph.
Oh, I love that one, Miss Estes. I wasn't thinking that in my little head here. That was really good. So you guys have lymph. We're actually going to study the lymphatic system a little bit in here so that we understand the brilliance that Miss Estes just said. But you have a lymphatic system that kind of picks up the debris and the waste in your body and foreign invaders and stuff like that. And massage does seem to encourage lymph movement, so it gets lymph not out of your body. It gets lymph circulating in your body and cleaned up more regularly. And lymph, by the way, tends to kind of pool down in your lower body because gravity kind of pulls it down there. So yeah, massage can help move your lymph. That was a much better answer than I was thinking. That's one reason. Sure. Beautiful. Yes, Miss Walker T.
Well, you're always talking about how massage, improves blood circulation. Blood is life. So if your blood circulation is working better, then that means your body's able to get all its nutrients and carry everything it needs better.
Yeah, good point. Just
so
work on
that. Likely to have disease.
So you're bringing more life to the body, so to speak. I love that. That's great. So lymphatic flow and blood flow, and yes, Mr. Blygen. We'll see, buddy. I see your microphone, but I can't hear you. Did you type in the chat box? Is that what you're trying to tell me? Oh, increases white blood cells. Thank you, sir. Does it increase white blood cells? Probably. White blood cell production? Quite possibly, yeah. Oh, Miss McDowell, I'm sorry. There's a lot of faces to look at. I see your hand is raised, though.
It increases the parasympathetic nervous system, so you're able to relax and digest.
These are really good answers. Yes. So we're going to learn about the nervous system also later on. And the nervous system has 2 modes of operating. A sympathetic and a parasympathetic, and believe it or not, the sympathetic's not so good. It is at times, but your body does something really, really smart. When it is worried that it is being attacked by a lion, it shuts down all other systems so that it can put all its energy towards fighting that lion or usually running away from the lion. And we call that fight or flight mode. But it really is a mode. It's a mode in your nervous system that does something very intelligent. It says, I'm going to stop, by the way, sending blood to my stomach, for example, to digest food, because if the lion eats me, it doesn't really matter if I digested my lunch. Just doesn't matter. And countries do the same thing, by the way, when they're at war. They kind of par down on educational things like that, and they start focusing on making tanks. But your body does the same thing. So one of the other things your body does when it's in this fight or flight mode is it literally stops things like fighting cancer. You all have cancer in your body right now, by the way. You know that. They told you that when you enrolled, I know, right? You all have deadly diseases in you right now. I mean, every last one of you has deadly diseases in you right now. But your immune system beautifully keeps them at bay. Your immune system beautifully keeps them at bay unless you're always in fight or flight. And so one of the most beautiful things that massage does is it relaxes people and puts them in the parasympathetic nervous state where they start to heal themselves. And that might sound, like, oh, that's so nice, Tab Scott. You relax them, and yeah, I understand. Every time I say this, everybody always goes, yeah, stress, it's a killer, right? And then what do? You start stressing out. And I'm not picking on anybody because we saw a couple Red Bulls, but you drink your Red Bull and you keep plunging through it, right? Stress, right? Stress kills. It is now a proven fact. This is not a hippy-dippy massage therapy thing. It's not, and it doesn't kill in some situations. It's a proven fact that it's the driver of almost all disease is stress. Yeah. This is giving you stress. Yes. You mean your microphone, sir? Okay. Hey, we're starting to communicate though now. I kind of like it. It's kind of fun. Anyway, but it is stressful, yes. And our bodies can't tell the difference between what we imagine and what is real. Right? This is why reading is so pleasurable, actually. When you read a book, you imagine what's going on in the book, and it's real to your mind, right? Saw some of my readers out there go, yeah. That's why you get lost in those books, even more so than a movie, because your mind is making up the movie, and it's actually much more powerful. So anyway, yes, so I firmly 100% believe this, and you're going to find out that I'm not one of these people that's like, oh, everything's, just magical all the time. But the fact is I 100% believe that you will cure people of cancer that you'll never know about. Unfortunately, that's the problem. Because you will literally just reduce their stress level. And I don't mean one person, I mean lots of people. Yeah. We are dying of stress, especially in this country. Dying of it. And look at our death rates in this country compared to other countries. It's not outstanding like in a good way. It's astounding. Do you guys know that do you know that the infant mortality rate in the United States is 38th in the world? That there are 37 other countries that you're more likely to survive childbirth in? The United States of America. We come after Slovenia. And if you're from Slovenia, that's not a diss on Slovenia, but I would just kind of expect one of the richest countries in the world to be like second, right? Were you going to say something, Ms. Rodson?
I'm not surprised at all, but I worked in healthcare for a lovely 5 years, and I was horrified.
It's not healthcare, it's sick care.
Specifically, like Trauma 1 unit, and the
Yeah.
way that they treat their patients
It's crazy.
is disgusting.
Yeah.
But
But I will chime in on this, by the way. This is also the best country in the world to get shot in, too. Our trauma stuff is amazing. United States. Like if you get shot here, somebody flies you out with a helicopter, puts you in a hospital, and they'll save you from that kind of stuff really quickly. We're very good at lunging in there and do that, but we're not good at health. This kind of overall health. So you're much likely to live much longer in most other developed countries, the United States, because of stress. Stress. So anyway, you will be, don't underestimate, like while I'm teaching all this stuff and being like, you got to get in the gluteus maximus and you got to release the piriformis and you got to figure out where this fascia is going and you have to figure out the curves and the angles of the low back so you release tension to the neck. All that's true and it's really exciting. But a lot of what you'll be helping your clients with is just like, hi, I'm so glad to see you today. I'm the one person you like who's not going to stress you out. Come lay down on the table. I'm going to give you a massage. They're actually receiving something they don't have to repay too. They have to pay you cash, but you're the one person in their life that does something nice for them they then don't owe later. And they can actually just rest for an hour. For some of you, think about it. When's the last time you really rested? I'm not talking about falling in bed asleep at night where you're like, so exhausted. And you that's what I gotta do next time. I'm talking about where you're really like rested. It might have been a while. Yeah. Okay. So thank you. So that's one thing. So when people say, why should I spend $100 on your massage? Because it could save your life. Because when's the last time you've rested? Because being in the relaxed parasympathetic state actually heals hundreds of other things that we don't even know about. Because your body functions better, because the lymph moves better, because you produce more white blood cells, all that stuff. True, true, true. All for the low, low price of $100. Boom. Okay. You won't use any of this stuff in massage, these words, although you will have a test on them. You probably have heard some of these words, though, recently, since we're all in the middle of an epidemic. And epidemiology is actually the study of how epidemics spread. So you'll hear a lot of people talk on TV about COVID, and one of the big arguments that I think is a very good argument is to say, is that person an epidemiologist? Meaning, is that person somebody who's experienced how disease spreads? Yeah. So let's talk about how disease spreads in the massage world, because it really spreads almost exclusively through touch. Now, I understand we have a COVID virus going on, and it will definitely spread through the air from that. But later, most of the disease problems you have to worry about in massage are merely from touch. And as long as you wash your hands after every single client and don't rub your eyes before you do that, things like that, your disease transmission possibilities are almost zero. Almost zero. I have never known a massage therapist to catch a disease from a client. Doesn't mean it's never, ever, 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 ever happened, but it's almost never, ever, ever happened. And here's why, by the way. Your skin is an incredible barrier. It's really quite amazing. Usually when we get sick from something, it's not because it came through our skin, it's because we put it into our mouth, right? But your skin's an incredible barrier, and your client has skin too, and that's an incredible barrier, and then you're using lotion or oil, which actually creates a very thin barrier between the two. So as long as they don't have an open cut and you don't have an open cut and you're not rubbing them together, it's really, really hard. I've worked on patients who were HIV positive and things like that, and people used to get really nervous about that. They'd be like, oh my gosh, this was in the earlier days of AIDS. And it never worried me. It's extremely hard to catch these diseases if there isn't fluid transmission. So, and you know, not to be inappropriate, but you only get fluid transmission when you share needles or you have sex. And don't do either one of those with your clients, right? So anyway, you can feel very safe. And that doesn't mean you can't put on gloves if it really worries you, if you have somebody who's sick, but it is really, really hard. You're a high pressure system. When you cut yourself, blood wants to come out. When the client cuts themselves, blood wants to come out. It doesn't want to go in. And as long as you don't rub cuts on them, you're fine. It's just never going to happen. Yeah. Good news. Which is why massage therapists, by the way, aren't any sicker than anybody else. Probably less sick in some sense. Well, this is depressing. Last time I taught this, we weren't in a pandemic. But anyway. But let's really quickly use this pandemic that we're in. We are in a worldwide pandemic. One of the largest ones on record, probably since 1918, the Spanish flu pandemic was around. They couldn't invent a vaccine back then, and so we were in a much luckier position. But they had actually some of the same problems that the 1918 flu pandemic, that people didn't want to wear masks and all sorts of stuff. But that's a pandemic. Morbidity is just how many people are affected by a disease in a certain population, and mortality is how many people die from a disease in a particular population. And not to be depressing, but our country is in a crisis right now. We have now lost more citizens to COVID-19 than we lost soldiers in World War II. So it's big. It's big. And one of the arguments, by the way, you'll hear is, well, people say, well, they didn't die from COVID, they died from COVID complications. That's true, but that's how all diseases work, just so we understand that. So people don't die from HIV and AIDS. Did you know that? They die from the pneumonia that they get and can't get over because they have AIDS. So that's like saying nobody's ever died from AIDS. They all died from pneumonia and other things. That's true, but it's not true. They would be alive if it wasn't for AIDS. That's exactly what's happening with COVID. People are dying from things they wouldn't have died from because they have COVID. Does that make sense? Just so we understand how disease works. I'm not trying to make a big political statement. I'm not. But I'm just trying to say AIDS works that same way. Nobody dies from AIDS. They die from diseases they can't fight off because they have AIDS. Cool. All right. Oh, this is kind of interesting. R naught. It's RO. It's R0. And it's called R naught. It's a very interesting number. I don't know if any of you have seen this, but they've actually used it with COVID. It is the ratio of how many people get infected per infected person. So if you have an R naught of 1, that's great, actually. That means every person that gets infected usually infects one other person. Right? So I get infected and I give it to Miss McDowell, but she only, gives it to Mr. Tate. And it's just a simple chain. The problem with COVID and things like that, I don't remember what the R naught is, but it's higher than that. It's like 2 or 5 or whatever. So one infected person gets 2 to 5 people infected. And that we look at R naughts a lot in diseases. We really care as they get higher, right? And a lot of reasons we wear masks at school and all that kind of stuff is to lower our R naught because they're proven to do that. So that one person doesn't wipe out 6 people, get 6 people sick. That's R naught. So when you see an R naught of 5, 6, 7, that's a really bad disease. It means one person gets sick and they get a lot of other people sick. And by the way, it's an average. One person gets sick and gets nobody sick. You know what I mean? Another person gets 21 people sick, but they average it. We are not going to go into... Oh, we did do COVID. Oh, wow. The R naught for COVID is 5.7. Interesting. So roughly one person with COVID gets almost 6 people sick. The R naught for flu is 1.3. So flu, you don't transmit to a lot of other people except 1 1/3 other people. And with COVID, you're more likely to almost transmit it to 6 people. That's the problem with COVID. It's highly infectious. It's more infectious than flu. Okay. Let's not get into all this. That's enough. It's enough. So there are risk factors with disease. Things like diet, exercise, and stress are modifiable ones. It means they are in your control, right? I could eat less, I could eat better, I could exercise more, things like that. And there are non-modifiable ones, which are age and genetics. As a massage therapist, you will have to make certain decisions based on somebody's age. I recommend that you don't focus on the physical number. And that's not because you're trying to be all enlightened. It's because I have worked on 80-year-olds that are healthy as a horse. And I've worked on 30-year-olds that are not doing well. Judge them based on how they actually look and act. If they're 85 and they come springing on into your office, they might as well be 45. They really might as well be. So kind of judge them more based on that. We'll talk more about that later. Because there's just a huge range in our society. Let's take a little break because I feel like this stuff's super dry. We just talked about COVID. It's a bummer. Let's take a 12-minute break and we will come back. Applications. Let's continue. I'll tell you something in a second. Okay. So we're going to talk really briefly about different types of diseases and disorders. But here's the thing is, I told you not to diagnose. You're not going to leave this class capable of diagnosing. So you don't really know what a client has, so how do you really tell if you should work on a client or not? And I want to give you, it's going to sound terribly simple, but it's actually really good advice, and it served me very well. But it's not textbook advice. So I use two things, and I've never gone wrong with them. And if I'm determining if I'm going to work on a client, one thing I use is kind of the walk around the block test. That's just what I call it. It's a terrible name, but let me explain it. I kind of ask myself, can this person in front of me walk around the block? Now, by the way, don't be clever and say, what if they're in a wheelchair or whatever? Then can they wheel around the block? But what I'm asking myself is this person systematically healthy enough to kind of go around the block? You know, if you're going to have a hard time getting around a block, means you're running a really high fever or you're extremely aged or things like that, I need to really consider whether I should do a massage on you. But essentially, if you can walk around the block, I can probably do some kind of massage on you. That's just the rule of thumb I use. It doesn't matter. And by the way, let me give you some really tricky scenarios. Somebody comes in and they say, I'm on chemo, but they feel great. And they look like they can walk around the block. It's for a very small little issue and they're getting chemo directly into that area. And I just avoid that area. I probably would work on them. They can walk around the block. They're fairly healthy, right? But I get somebody else come walking in. They're running a fever, they're breathing hard, you know, I may not work on that person. That person doesn't look like they can walk around the block, right? So it's a very good rule of thumb, and I don't know if it's exactly a block or whatever, but it's a really good way to check yourself, because you're gonna get all confused and be like, well, is it cancer, or are they running a fever, am I doing this thing? But we're just trying to figure out, is this person gonna be worsened by me rubbing them? And basically, people that can walk around a block can handle a massage. Almost any massage, by the way, but definitely a medium kind of ordinary massage. Now, I don't go deep tissue on people I don't think are quite healthy, because deep tissue, we're digging into your tissue. It's got to be kind of resilient and springy. And looking at people's skin, by the way, is a very good way to tell how deep a massage they can take too. Is their skin elastic, or is it kind of brittle, thin, and not elastic? That's something to tell too. But forget about that. Walk around the block. Just a really good rule of thumb. So if somebody comes in, they're decrepit and they can't seem like that would be a challenge for them, then you might want to be very careful about their massage at that point. Does that make sense? The second thing I'll tell you is that has served me very, very well is, has anybody ever gotten like a carpet cleaning product, and on the carpet cleaning product, it says, test this in the corner of your room before you use it everywhere? Anybody ever seen that? No. Somebody, okay. The reason they do that is because if it lifts the color out of your carpet, the carpet company, the cleaning company, doesn't want to pay to replace the carpet in your whole house. So they tell you to test it in the corner. And I use the same thing. I call it like test the carpet or whatever. But the reason I say it is I do this with massage too. So let's suppose you come in and it's a little iffy whether I work on you. Well, let's test out what we're doing, right? So Miss Estes comes in. She's looking like it's a little rough to get around the block, but I probably would still work on her. She's not dying, like it's going to be okay, but she's not super springy bouncing on in. And then she tells me she's got this back issue and she wants me to go really, really deep on it. And so like she's sure that's the right thing. And I'm just like, I'm not quite feeling it. You know, I'm just a little bit worried. Well, I can test that theory out. We don't have to do it all today. So I can test out in two ways. One is not go as deep. The other one is not go as long. Let's do 10 minutes of deep tissue on her back, not an hour or 2 hours. I've never worked on Miss Estes before. I don't know how she's going to handle it. I was already having some iffy feelings when she walked in. I'm testing the carpet, and I'll tell Miss Estes that, hey, I really love doing deep tissue. I think you really could be right, and it's your body, but I really want to see how you react to this. So we'll do this, and then we're going to do some light stretching in other areas, and I just don't feel comfortable doing the whole thing deep tissue this time. If you feel okay next time, we'll go gangbusters. And then she walks in next time, and I've had this happen both ways. She walks in next time and she says, I felt better after you did that. Okay, well now we got a pretty good idea that that treatment works, and she tolerated it pretty well. Still actually not going to go full bore on her, but we'll do like 30 minutes of that kind of stuff on her back next time, right? I've also had people come in and they've honestly thanked me afterwards. That, wow, thanks that you didn't do the whole massage like that. I was really sore afterwards. They weren't damaged, but they were really, really sore, and it was a good thing we didn't do the whole thing. So feel like you can test the carpet. You can do a little bit of something and see if they get better. If they get worse, that's the wrong treatment for them. Doesn't mean they can't get massaged, but that's the wrong treatment. Like that was irritating that area. If they stay the same or get better, even stay the same is fine too. You can kind of continue that path. But don't forget about the walk around the block. Don't get lost in all the diseases because you're often wrong with the diseases, all that kind of stuff. And the walk around the block thing kind of tests whether they're systematically okay. People with really high fevers would have a hard time walking around the block. People that are under chemo and it's really taxing their body would have a hard time walking around the block. People that are really frail would have a hard time walking around the block. That's the time to really be like, wow, we got to be super careful. Yeah? Cool. All right. Because there's too much gray area in this. That's the problem. And when in doubt, by the way, I do want to warn you about this. I've never once had a problem. Not once. But it's your responsibility. It's not the client's. The client's going to be like, work on me, work on me, work on me, please, 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 I want my massage. But if anything happens, it's your fault. You're the practitioner. So if you're really getting a feeling like, I don't know, this guy, he's telling me to go really deep on him, but he could barely make it through the door. His skin doesn't look so good. He's never had massage before, not from me before. I don't know him. Those are a lot of warning signals to start backing way off. Maybe you still do the massage, but you start backing way off, right? There's all that middle ground. Cool. All right. Thank you. Yeah. Oh yeah, Miss Suriel, please.
I have a quick question because of what you're talking about. What if a client comes and I don't know too much, but let's say he has this predisposition or symptoms of having a stroke or a heart attack, and he's like, my arm is hurting and then I have a headache, and it's like he talks a little bit like not very well, he's a little disoriented, but he just may say, oh, it's just a pain in my arm and I want you to work on it. Are we able or should we ask for more symptoms? We're not going to assess anything, but I feel that some people, they just ignore symptoms, and what can we do?
Yeah. So thank you. Those were really good descriptions you gave, by the way. So she described a person who's having an arm problem. You're going to get lots of people with arm problem. Lots of people get tingling in their arms, stuff like that. By itself, not too big a deal. But then she described some other things. Headache, slurring of speech, a little drunken maybe, right? Disoriented. These are signs of stroke. But don't even worry about that. Wouldn't that seem unusual to you? Even if you didn't know that was a stroke, if I was like, there's some stuff going on, what was I talking about? Like, you're gonna be like, this guy's drunk, or there's something wrong. That you don't have to diagnose, but that's a great time to say, I think there's a big problem here. And so, by the way, you'd be justified to call 911, right? If you really think he's having a stroke, call 911. But that would be a really great time to, and you're always really sweet. We're always super sweet with people, and we always tell them, I don't know. You know, I'd be like, hey, if that was you, Miss Suriel, I'd be like, hey, Miss Suriel, I don't know, but I'm kind of concerned. There's just some things that seem odd here, and I'm kind of worried about your health. And you're like, no, it's just my arm, fine, right? You're kind of belligerent now a little bit. I know you're fine. I know you're fine, but I'm not feeling comfortable about this, and I care about you. I just met you, and I care about you. I always make it about you, right? I do. I care about you. And I actually think we should call your doctor. Is there somebody I can call to give you a ride? I think we should call, but I'm sorry, I'm not going to do the massage day. I'm so sorry. I won't charge you next time. Just don't charge them. This is going to happen so rare in your life, guys. So rare that it's worth just being like, I won't charge you. And if everything's okay, we'll work on you next time. I really want to work on you, but I'm a little bit worried. Something doesn't seem right to me here. You know, and try to call with all the symptoms you've said. I'd be calling 911. The slurred speech and stuff really worries me. slurred speech, no smell of alcohol, things like that, I'd be like, yeah, there's something wrong here. So yeah, you guys don't have to diagnose to be worried about somebody. You know when something's funky, right? So when people start feeling disoriented and things like that, that's when I start to worry. Yeah. So yeah, just be sweet. Try to get medical attention. The good news is, I want to reassure you about all this, is almost nobody comes into you with this stuff because they can't get to you. Right? They're already having these problems. They don't usually show up, thank God. Thank God. Because you read the book and you're like, oh my gosh, how many clients a week am I going to have heart attacks and stuff like that? I've never once had. Some of the biggest problems I've ever dealt with and that most of you will ever deal with is people having what's called orthostatic hypotension, which is that when you lay down, your blood pressure drops. So if you get up really quick, have you ever gotten up really quick and you're like, whoa? Clients get up really quick from the table and you've got them really relaxed and they can pass out. Now the danger there is not them passing out. The danger is them falling down and hitting their head. That could kill them. But the passing out's not a problem. If they just passed out on the table, they'd be fine. They'd come back. It's just low blood pressure. It goes away right away. So that's the biggest stuff we'll probably ever deal with. But yes, if you think somebody's like, I've got chest pains, they're having a hard time breathing, right? They're slurring their speech, things like that, call 911.
And one last question.
No,
because
please.
You just mentioned, and it just calls my attention. What if someone, because there's a lot of people that I've seen and hear that they go drunk to take massages.
Yeah.
What do you do?
I'm glad you asked. I have an opinion about it. I'm assuming your book says you don't massage people that are drunk. Or that, and by the way, I would agree with that. So, you don't massage people who are drunk like that. Okay? I'm wasted. I'm hammered. I'm slurring my words. I'm laughing. I'm weaving. Don't, because there's all sorts of problems you can have. For one thing, who knows how I'm going to behave? I might roll off the table and hurt myself. I'm actually not worried about the massage. People, by the way, what all massage therapists will tell you, and it's a bunch of baloney, is they'll be like, well, you're going to release all the alcohol in their body all at once. Trust me, the alcohol's already in their body. If squeezing people when they were drunk killed them, there'd be a lot of people dying these days because lots of people squeeze each other when they're drunk. So, that's not the problem. The problem is you've got somebody who's a dangerment to themselves. If somebody's noticeably drunk, don't work on them. That said, when I used to do alcohol, I can't tell you how many people definitely had a couple of glasses of wine and maybe a joint before I went over there, right? And I personally don't care. I don't think it's an endangerment to them. They walk up to me like this and they're like, hey, how you doing? Hey, Mike. Yeah, they look kind of mellow. Yeah, but they're fine, talking normal, all that kind of stuff. I smell a little bit of wine, maybe smell something else in the air a little bit. That's not my business. Now you can deny service to that person, but I gotta tell you, you're gonna deny service to about half your clients if you're denying service to people who have a glass of wine before their massage or other mild altering substance. I'm not going to make a judgment, by the way, whether people should drink or smoke pot. I'm just telling you, a lot of your clients will, and a glass of wine, to me, it makes my job easier because they're relaxed. They're at home. Who wouldn't want to, I'm sorry, who wouldn't want to have a glass of wine and a massage? This guy, if you come over to my house, you better not turn me away because I've definitely had a glass of wine. Want to, because I'm laying on the table, I don't have to drive, but that person's not drunk, right? So again, you don't have to know. You're worried about anybody who's kind of slurring the words, or they're either drunk or they're having a stroke or something's wrong, right? And my kind of thing is, it's kind of like, don't ask, don't tell. If I don't know, if you're acting fine, then you are fine. Yeah, I'll tell you what we do worry about, by the way. Not pot and alcohol, painkillers. So, and not people, they could be abusing them, but I'm not talking about that. I'm talking about somebody hurts their arm and they get some painkillers from the doctor. They can't feel any pain, so judging the depth on them is very hard, right? They'll be like, you could go deeper. And it's like, you're high as a kite. Of course you think I can go deeper. You don't know. And the next day they wake up and they're like, what did you do to me? Painkillers we worry about for that reason. Because they can't tell how deep the massage is. But yeah, it's not clinically correct, everybody, but I would recommend that you kind of ignore the occasional glass of wine. I really would. You're not going to hurt them, I promise you. I worked at a resort, and I'm sure that 92% of our massages people were drinking. And I had a therapist one day come up and say, like, I smell alcohol in this person's breath. And I said, are they acting unusual? No, but I smell alcohol. I can't work on them. That's against, this thing that I read in this textbook. And I was like, well, then we might as well shut down the spa. Like that's it. So it's not, alcohol, everything in small quantities is fine, essentially, in life, right? So yeah, let that go. But I would turn away drunks. They're always a problem. Drunks are a problem, right? They're handsy, they don't listen to you, they roll off tables, they fall asleep, yeah, they're a problem. Cool. Okay, these are great questions. You're taking me back. Some fun times. Let's see. Yes. Is that Miss Sarno? I just saw you a second ago. Yeah? No? Miss Sarno? No? You were there? We put June to sleep. Oh no? I thought we did, June. You're not actually a student, so you can sleep through my lecture. It's probably the second time you've heard it. Okay. Really quickly, some stuff, because it does tie into what we've talked about. So, cancer. Cancer, by the way, a lot of people don't realize is abnormal growth. It's usually excessive growth of cells. It's your cells gone wild. We think of cancer as this like invading thing that's evil and things like that. Quite often, it's cells that are growing out of control in your own body. And you have other cells that will kill those cells. But you have to be in the parasympathetic state, as Ms. McDowell explained to us, for those cells to be working. If you're in fight or flight all the time, they don't go around and look for those things that don't kill them off. The reason I bring up cancer is because they've really changed their view on this. So one of the fears about cancer is it can metastasize. Metastasize is when cancer it starts here, let's say, and ends up over here and then down by my feet. And metastasize means it spreads throughout my body. And they used to, about 20 years ago, they used to really worry that massage would help cancer metastasize. It made sense, like you'd rub it around the body and you'd kind of move the cancer along. That is no longer a fear. I don't know any doctor that believes that anymore, because they're like, your heart's pumping all the time, your blood's going around your body all the time, your lymph's going all the time. The massage isn't moving the cancer around any more than anything else is, and probably not at all. And if anything, the massage really might be helping, because reducing people's stress and things like that when they have cancer is a really big deal. So as long as the chemo is not bothering them, and if you're ever in question of that, like you're like, I don't know, ask them to get a release from their doctor, because their doctor will be like, yeah, it's fine, or no, you shouldn't, that kind of thing. But don't worry about massage metastasizing or moving cancer around people's bodies. It doesn't. It just doesn't. That said, some of the worst cancers in the world are ones that get into our systems that move stuff around the body. So lymphatic cancer, when it's in your lymph system, is very, very dangerous, because your lymph system has ducts all around your body. Yeah. Okay. Let's see. Oh, deficiency diseases. Yeah. This doesn't pertain to massage. Sorry. I'm not going to talk about it. You will have some clients with degenerative diseases. Osteoporosis, which is bone degeneration. You can usually see this in somebody's posture. That doesn't mean you can diagnose it, but if somebody's quite old and they're kind of hunched over and stuff, that's usually bone degenerating. It's also, by the way, poor posture their whole life that's catching up with them, because that just happens to all of us. But bone degeneration, so if somebody comes in and tells you, people know that they have osteoporosis, you can still massage them, but it's probably not a good time to get up on the table and put both your knees in their back, right? Their bones aren't designed to take that kind of crunching on them. You could break a bone. I've never done it, but again, this person will look frail to you. Does that make sense? That's the nice thing. You don't have to be like, I've done a bone density test. They look frail, And that doesn't mean you can't rub them, but think about that. With this sweet little lady who's on your table and she's kind of already hunched over already and kind of like, you're not going to push down with all your might on her back. Yeah? You're going to think more surface and less down. Oh. Cool, cool, cool. No, I'm not doing that. Just thinking if there's any other highlights that you guys should know about. So pathogens are essentially things that carry disease around. And one of the things this entire chapter, and I feel like the book fails to say this, but I think it's thinking it, is regardless of whether this is bacteria, or fungi, which is essentially mushrooms, molds, viruses, protozoas, protozoas are kind of like bacteria, kind of, but they don't have their own DNA. Well, they're kind of like viruses, but they don't have their DNA. And pathogenic animals, which are tiny little mites and things like that. All this stuff, though, what your book kind of fails to mention is that what it really needs is a middleman. And the middleman is you. So our job is to not carry disease from one client and give it to another. And you really, really do maintain that by washing sheets and washing your hands. There's almost nothing that's going to just leap onto you, and you wash your hands and you change the sheets and somehow it's still there and it's going to leap onto somebody else. It just doesn't work that way. And that's the good news. So we just want you to recognize that regardless of the pathogen, regardless of what is causing the disease, that in general, just basic hygiene really, really helps. I will say one other thing. Can you see how short my nails are? Do I have nails? No, none. Because nails scrape up skin off people, and then even if you wash your hands, it stays under there, unless you pick it out with your teeth. That's kind of nice because you can taste the last client that you had. And then you scrape it into the next person. Nails are great at carrying pathogens around. Trim your nails. It's a bummer. It's a bummer. If you loved your nails, it's a bummer, but trim them now, right? If you're worried if they're short enough, do you know how you know if they're short enough? Anybody know? It's if they bleed after you trim them. It's a joke, I say, but I want you to trim them low. They should hurt in the beginning. You'll never have to clean them again. Mine are trimmed so short they can't get dirt in them. They just can't happen. Anyway, short nails. That's it. Let's see. Your book will talk about congenital disorders, which are just disorders that are present at birth. These are a lot of definitions that you won't necessarily need to know as a massage therapist. This is important. Traumatic disorders. Traumatic disorders are when somebody has experienced trauma, and we're not talking about like PTSD type trauma. We're talking about they've been in an accident. So, of course you wouldn't work on somebody who just broke a bone until the bone got fixed, right? But I want you to think about this, because this will happen to you. Guaranteed. Somebody will get in a car accident, right? And it won't be the end of the world, but they get in a car accident and they'll come to you and they'll be like, I got in a car accident, man. I got to get a massage. And I'll be like, oh, okay. When that happened? Oh, like 2 hours ago. Oh, no, no, no. Now, they can walk around the block, I admit. They look pretty good right now. Why am I not going to massage them? Yeah. Yes. Miss Trotter. Yeah.
Is it because like the adrenaline's adrenaline?
Adrenaline.
Like yes, adrenaline. There we go. Thank you. That's still like pumping through their veins, so they're not really feeling like the soreness or like if anything has happened, like if the muscle strain or something, they don't feel it yet.
Yeah, I think that was actually even a better answer than I had, actually, Ms. Trotter. That's essentially it, yeah. So, adrenaline, but not only that, like I don't know, maybe there's some problems from that accident, and the next day, those problems could be your fault, right? So, but the adrenaline is actually, you're right. I mean, have you guys ever been hopped up on adrenaline and something, you're like, that doesn't hurt at all, and then 2 hours later, you're like, oh my God! That's the most painful thing ever! I've had that happen before. I'm like, it doesn't hurt at all, and the adrenaline wears off. Yeah, so don't. I hate turning clients away, but I like to at least be a day. It really should be 2 days. 2 days is when all the really nasty stuff starts happening, when they're like, wow, I can't even move my neck. Good, but we kind of figured out that's from the car accident now. Otherwise, the next day when they can't move their neck, was it the massage or the car accident, right? So when people come in and say, you know, oh, I just got in a car accident, I really need this massage, again, you got to be really nice because they're not happy. Nobody likes hearing they can't get their massage. But I'm like, hey, Miss Trotter, I know, man, I would love to give you a massage. You just went through this traumatic experience. I know what it's like to wreck my car. Oh my God, it's awful. Awful, totally awful. We've got to rebook you though. We just don't know, it's not safe. You know how much I care about you. It's not safe. I care about you. Care about you, yeah. I do. Yeah, so tell you what, we'll rebook, can we wait like 3 days? I just want to make sure you're okay. All right, and if you're not feeling better tomorrow, I'm going to call you tomorrow, actually. Yeah, no, I'm doing it. I'm going to call you. No, you're my regular client. I love you. Calling you tomorrow. Going to check on you. If you're not doing well, you're going to go see the doctor. Know how stubborn you are. Right? And that might seem silly, but you're actually doing somebody a favor. People are lonely. They don't have people looking out for them. It's your job to look out for them. Right? That doesn't mean Miss Trotter and I are buddies outside of the massage room, right? But I'll check up on her and stuff like that and show a little bit of care. And then call her next morning. She's like, I feel great. Oh, well, cool. You feel completely great now. How about we schedule 1 day out then? Maybe just 2 day wait, right? She's feeling great. Next day, she still feels great. Okay, fine. Yeah. And by the way, a week later, she feels awful. I'll work on her too. Because now we know that awfulness is from the accident, not from me. You know what I mean? But just give it a little bit of time. That's what I worry about traumatic disorders. That's my little thing about that. That's pretty important. We're not going to go into viruses and bacteria, even though they're fascinating. They're fascinating. I see faces being made, but viruses essentially take a little piece of code and have your body make more of them. It's kind of cool. It's kind of cool. Anyway. Oh, by the way, protection from all this stuff. Hand washing, all that kind of stuff too, but good night's sleep for you guys. Because believe it or not, it's your immune system that protects you from all this stuff. Right? So people without immune systems, they literally do have to put them in a bubble. They can't fight off anything. People with great immune systems, you know, they can wipe the counter like I just did here and lick their hand and they're fine. You know? Okay. We're not going to get into all that right now. So just remember, you are the thing that can carry infection around, which also means the stuff you use is the stuff. Your oil bottle, this is not an oil bottle, but I had to grab something. Your oil bottle is also the thing that carries infection around. I give Miss Trotter her massage after the car accident 3 days after, and I squirt this on and I rub it on her, but you know, she's got some horrible skin disease. I'm sorry, everybody knows now. And then I touch the bottle again, and I wash my hands later, but the bottle really should be wiped off too. Because that's how you stop that kind of stuff. And then you're fine. You're absolutely fine. Oh, and by the way, when we say wash your hands, soap and water. It's more important than hand sanitizer. Soap and water is more powerful than hand sanitizer. Soap and water is more powerful than hand sanitizer. Yeah. It's amazing what soap and water does. And that's not just me. Talk to doctors. They'll be like, oh yeah, soap and water is amazing. It's amazing. Okay. I just want to know if there's anything else to tell you about. You will hear about universal precautions. And there are a few rare situations, I feel like this has happened to me maybe twice, where, well, maybe more than twice. Remember, the one thing you do have to worry about is bodily fluids getting into your body, right? And it's very hard to do that from rubbing somebody, but let's suppose somebody bleeds on your sheets. You're supposed to take universal precautions with any type of bodily fluids. You really wouldn't want to be touching that stuff. Your skin would probably still protect you, but let's not mess with that. And so it'll happen so rare to you that I would just literally put on gloves, package up the sheets, put them in a plastic bag, and throw it away. I really would. But if you don't do that, dump a lot of bleach in there and throw some hot water in and put it in your washer, and a lot of bleach will kill it. If there's any sheet left, who knows? But the point is, because the bleach will get the sheets too. But still, that's the only thing, is just don't touch fluids. That universal precautions, by the way, means you put gloves on, an apron, an eye mask, and all that kind of stuff to go get these sheets. You don't need to do that. That's a little bit overkill. Just don't touch the sheets and wrap them all up and all that kind of stuff. Universal precautions. And again, I don't think I've done a single massage in my life with gloves on. Skin is a very good protectant. It really is. But I have put gloves on before cleaning up after stuff, where I'm like, oh my gosh, there's blood involved here, things like that. Yeah, then, absolutely. Okay, we already talked about soap and water. Oh, soap and water on everything you use. So like for me, that's up to about here. No, that's up to about here. Like it really is, I use my forearm and everything. So you're washing it all, right? Cool, cool, cool. Okay. It's not just your hands. I'm not gonna worry about hand sanitizer. Be a little careful with hand sanitizer, by the way. You have to wash your hands anyway. Hand sanitizer, for some people, kind of cracks their skin and dries it out. And believe it or not, that's a worse problem than the hand sanitizer is fixing. You don't want your skin cracked. That's not worth it. Don't use a hand sanitizer. Just wash your hands. Have you all seen proper glove removal techniques? Yeah, let's grab some gloves. Do we have some gloves? Hold on. All right. Sorry, I promise you more excitement from here on out. But if you wear gloves, and if I can get them on. All right, we're not getting them all the way on today. Da-da-da-da. The idea is you don't want to touch the glove when you take it off. So a lot of people don't think about it, but you've got these gloves here. They've touched stuff, right? And so when you pull this glove off, you pull it over like that, right? And you take this one and pull it over like that, so that you're never actually touching the glove. Does that make sense? Yeah? Cool. Just think about it. You just don't want to contaminate yourself right after you've done whatever you've done. Cool. Talk about chlorine, bleach. 5 tablespoons of bleach is 1 gallon of water. That means in a washer, by the way, you've got to put like a cup of chlorine in there if you are really, a cup of bleach if you are really trying to knock stuff out. Let's see. Oh, sorry, I'm going the wrong direction. I hope. Oh, so let's talk about contraindications, right? That's how we started all this. That's what all this stuff's about. There are essentially 2 types of contraindications, local and absolute. The problem is some people call absolute general or systematic. So let me repeat that. Absolute contraindications are general contraindications, are systematic contraindications. Absolute contraindications means absolutely don't work the person. Don't work their nose, don't work their toes. Don't pass go, don't collect $200. Absolute contraindications mean absolutely don't work the person. General contraindications mean the same thing. They mean in general don't work them at all. And systematic contraindications mean the whole system's been compromised, don't work them. These days, most people call them absolute contraindications. Reasons to absolutely not do it, but I've also heard it called general and systematic. All three of those mean don't do the massage. I walk into your place, I'm on fire, that's an absolute contraindication. Throw a blanket on me, don't massage me, all right? I have a highly contagious disease. Highly contagious disease would be an absolute contraindication for your thing. I'm running a really high fever, running 103, 104 degree fever, absolute contraindication. I'm under chemotherapy, I'm sick from the chemotherapy, I do not look good, my skin looks a little gray, absolute contraindication. Ms. Suriel was very helpful. I come in, I've got pain down an arm, I act disoriented, I'm slurring my words, there's something wrong, absolute contraindication. This guy's not right. Cool? Local contraindication. Broke my pinky, don't rub my pinky. Burned my arm, whole arm. But not running a fever, the rest of my system's fine, don't rub my arm. Have a rash over here, don't rub my rash. Those are local contraindications. Got a sunburn on my back. Fell asleep outside, but it was just my back because I was wearing some weird whatever. Don't rub my back. That's just a local contraindication. Those happen all the time, right? So that's the difference. That's the difference between local and absolute. Let me tell you a little trick though. So because I hate turning people down for massage, and honestly it's not the money, well it probably is the money too. But anyway, but it's also because I care and they get upset, they want their massage still. I found like some little tricks that I can do sometimes. So let's say the sunburn. Let's say they're sunburned over their whole body. I've had people come in for massage, they're sunburned over their whole body, which really is kind of an absolute contraindication, right? It's a general contraindication. Where am I going to rub? Right? Plus they're so sunburned I'm a little bit kind of worried or whatever. But their feet aren't sunburned. What a great time to offer reflexology. People who love feet massage go, that's fantastic. I can still get my hour massage. It was already paid for. I'm at the resort. Whatever I'm doing, I can still get reflexology. I love the reflexology kind of catch-all. I've used that one many times. Like, hey, I'm kind of concerned about this other thing, but let's just work on your feet. It's a good way to not tax their whole system and just do a little bit of work on their feet. Now, this is not for the person who thinks having a stroke, all this kind of stuff, but just like, yeah, let's say, I'm not advising this, but I'm just giving you an example. Let's say you got in the car accident and it's your shoulder I'm worried about. Maybe I might do reflexology on you because I'm just doing your feet, right? I still don't think it's a great idea, but it's a good compromise. I want you to just be kind of thinking therapists, and these are things to think about, if that makes sense. So that way I'm kind of isolating your whole body and we're working a very small area. So, Miss Trotter, is a broken finger an absolute or a local contraindication?
Local contraindication?
Yes. You can work everything except that finger. Yes.
Yep.
Miss Hawks, is a high fever an absolute or a local contraindication?
Absolute.
Absolute. She's like absolute contraindication. I can't even say it. Thank you. You guys have the idea. So, by the way, very few things are absolute contraindications. Very few people come to you with an absolute contraindication. They just don't. That's the good news. People don't want to go outside of the house when they're on fire. They don't want to go outside of the house when their chemo is making them so nauseous they're throwing up. Why would they? They don't want to go out of the house when they have 103 fever. They don't usually come to you that way. Ms. Suriel?
I got another question.
Please.
What about people with psoriasis?
Psoriasis?
And because I have an aunt that she has psoriasis all over her back and her arms, and you can see the open wounds.
Yeah.
You will be dealing with blood and things like that. But I have a question. will be fine to do it over the clothes or the sheets, or definitely we're not allowed to touch.
No, you're allowed to touch. So I love what you said. So we don't want to touch the blood, right? And we don't want to make the psoriasis. This is super dry skin, everybody. That's so dry it cracks. And by the way, I have to tell you, the big worry about psoriasis is the poor client is so embarrassed. Like, think about all your body issues. They come in and they feel like they look gross. I mean, after you learn about all this stuff, you stop worrying about whether it's you start worrying about the poor person that has to come in and they're like, I really want a massage and I'm disgusting, and they're not disgusting, but they've got this scaly, dry, bleeding skin on their body. Anyway, so we're really sweet to them. We're like, oh my gosh, it looks so uncomfortable. And I always tell them this because it's essentially true. I see this all the time. It's perfectly normal. It is so relieving to have somebody say, oh, 6 toes. I see that all the time. It's completely normal. I've seen it quite a few times. Completely normal. Oh, psoriasis. I see that all the time. It looks very uncomfortable. I really feel sorry for you, but it's totally normal. Because I want them to know, normal to me. I don't think it's gross. Totally normal. Everything's normal. See it all the time. Anyway, yeah, through the sheet is a great idea. And but I wouldn't rub in such a way that I was cracking open, but you could compress, and absolutely I would. Right?
Can we stretch also, do some stretching?
Sure. Yeah, just as long as it doesn't seem to be opening up any of that stuff. You're talking about something that's really extensive, but they can still get a massage, and I love your idea of doing it through the sheet. And then certain areas of their body, maybe their feet are okay. You do those directly, yeah. And you can use gloves and stuff like that, but the real worry is that you don't want to make it bleed more. The real worry is about them. You should be worried about the blood, but I'm not that worried about the blood. I'm more worried about them. So yeah, you can work through the sheet and whatever. There's usually spots you can work, but yeah, I would try to figure out a way to give them a massage. These people need to be touched. People that have psoriasis, like real flaky, bleedy skin, people that are terribly overweight, people that have nobody else in their life, people that are too tall, too short, too something, too whatever, need to be touched so badly. We live in a really touchless society where people are either having sex or they don't touch at all. This saddens me greatly. It really does. And that's why we don't learn what safe touch is. You guys are actually the ambassadors of safe touch. It's a really neat thing. You will be some people, you will have many clients that have never been touched non-sexually in a healthy manner in their life except for you. They need to be touched. This person with psoriasis needs to be touched. I love that you're talking about it. You figure out how to do that massage, yes. You do it. Through the sheet, through the whatever. And I explained to him too, like, I'm doing this through the sheet because I don't want to irritate it. It's not that you gross me out. I wouldn't say that it's not that you gross me out, but I'm always implying like, this is just because I don't want to cause you any discomfort. But no, I see this all the time. Gosh, this must drive you crazy. Yeah, my aunt's got the same thing. Yeah, I got 17 other clients have the same thing. And the 6 toes. And they're overweight. Yeah, see it all the time. Yeah, go through the sheet. Not a problem. And by the way, lots of people do have psoriasis. And it seems to be stress-induced, makes it worse too, so yeah. And if you turn them down every time they've got a flare-up, you'd never have a client. I love that question. We talked about endangerment sites. Where are endangerment sites found? At the folds of your body. Yeah. Does that mean that I should be terrified to touch here? No. But does that mean this is the area right here in this dimple that I want to go as deep as I possibly can? No. Doesn't even make sense. Yeah. Cool. So armpits, knee pits, elbow pits, groin pits, and throats, and eyeballs. Watch out for eyeballs. Actually, eyeballs are pretty resilient, believe it or not. Anyway. Okay. So let's finish up with Tapscott's rules of safety. I think I've already talked about all these, but don't forget to test the corner of the carpet, which means you can always, it's like cutting hair, you can always do more pressure next time. And I'm a pressure freak. But if I'm in doubt of your health, if I've never worked on you before, we can always do more next time. Let's go medium the first time. Right? And let's go light if I'm seeing symptoms that you may not be so healthy. Let's do that. That's testing the carpet. Just check it out. You know, or they've got a problem and you're not sure massage is going to help or not. I've had that happen all the time where somebody's like, I've got a little bit of swelling here, but it's really light. And I wonder if massage would help. Well, the general rule of massage is you don't rub swollen things, but not always. So we rub it a little bit. And I say, let me know next week how it is. And they come back, they go, actually, I think it was a little bit better or the same. Well, let's try a little bit more. No brainer. Test the carpet. Second, this is probably one of the most important things. Be careful with clients getting up off the table so they don't pass out and hit their head. That's the thing after everything I just shared with you that I'm more scared of than anything. And by the way, I'll tell you this because I hope somehow it'll stick in your subconscious. Most people, when they see somebody passing out in front of them, they go, gosh, I wonder if they're... And then before they finish that sentence, I wonder if they're passing out, they hear the thud of their head on the ground. Grab anything going by. Their hair, their shirt. I would grab anything going by. Just grab it. You don't have to stop them from hitting the ground. You're just slowing down the velocity. Right? You can weigh 100 pounds and I can be going by. Grab my hair. Because you just want to stop this from hitting the ground full force. That's all. Don't worry about catching me. Don't try to catch me. Just grab my head going by, right? You'll save my life. It'll be all fine. And I'll kind of wake up and I'll be like, oh my God. And you'll be like, I saved your life. You better give me a good tip today. Okay. And again, I'm not worried about them passing out. I'm just worried about them hitting their head. Low blood sugar, low blood pressure, all that kind of stuff. If a person's able to walk around the block, they can get a massage. Maybe not your deepest massage, but if they can walk around the block, they can get a massage. You can almost not think of a time when that's not true. If they've been injured in the last 24 hours, maybe even 48, don't work on them. I do not mean they slammed their finger in the car door and you know that's the only thing that's wrong with them. You can work on them 2 minutes later if you want to. I meant they've been in a car accident. We don't know if they have whiplash. We don't know if they're going to be achy. You know, that kind of stuff where it takes a couple days for you to realize like, wow, I got really banged up. Has anybody been in a car accident where you felt really bad like 2 days later? Okay, good. That's a very common story. If you're ever unclear, get a doctor's release. Now don't send everybody who just sneezes to the doctor to get a release. But if you're like, I don't know, you're getting chemo. I don't know. Man, I just graduated massage school and my teacher wasn't so good. You need to get a massage, you need to get a doctor's release. Just ask them like, hey, I really want to know what your doctor says because the reason I'm a massage therapist is because I don't hurt people. People understand that. They're like, well, that's kind of cool philosophy. Don't be afraid to call 911. It will only happen once in your entire life. But if somebody's hard time breathing or things like that, call 911 right away. Just do it. You got nothing to lose. Nothing to lose. And even though I said all that snotty stuff about our healthcare and we're 38th in the country, we have in the world for infant mortality rates, that's all true, but we have the best 911 system in the world. Somebody will show up in 3 to 5 minutes and it'll probably save their life. So call 911. That's what they're there for. Okay. Let's see. Any questions? That gives us 2 minutes left to talk about any questions. I'm going to stop sharing.